Hello, how are you doing, guys? With you, Dr. Hamid, an ECV certified physician. We've got another high yield case for the pharmacology for the USMLE Step 1 exam. And this is a 26-year-old woman presenting with a pelvic pain and vaginal bleeding, and imaging shows adnexal mass with a gestational sac and plus no intrauterine pregnancy. The patient is stable and she receives the medication at first line therapy. And the question asks about which is the main mechanism of action of the preferred drug in this scenario. Pause the video and think about the correct answer. And the correct answer is D, which is the inhibition of the DNA synthesis in rapidly dividing like trophoblastic cells. So this patient has like a gestational sac showed by imaging, and no intrauterine pregnancy, plus pelvic pain and vaginal bleeding. This refers to like ectopic pregnancy. And you have to know like, the risk factor for ectopic pregnancy, which is like the patient having like infection, for example, cervicitis, chlamydia, cervicitis, or having a prior infection. Or the second risk factor, which is the patient having like a prior intra-abdominal surgery. And the third risk factor is the patient having prior ectopic pregnancy. You have to memorize this risk factor as you may be asked about them. For example, which of the following is like a risk factor for recurrence of ectopic pregnancy? Prior ectopic pregnancy, the patient having genital infection, and the patient having prior intra-abdominal surgery. This is the first thing you have to know. And let's tackle the wrong choices. A, blockage of the progesterone receptor to trigger uterine contraction. This is a mechanism of action of mifepristone. So mifepristone is like a partial agonist of progesterone. So during pregnancy, the progesterone levels are high, and giving a partial agonist is essentially like an antagonist in this case. Remember, you may need to watch our episode about the pharmacology partial agonist versus antagonism. So the partial agonist is not gonna like reach the maximum effect as the agonist. So during pregnancy, there is increase in the progesterone receptors in the uterus, for example, and there is a high progesterone activity. So giving a partial agonist at this phase is gonna act as an antagonist. So you have to watch for this. This is the mechanism of mifepristone. This is a partial agonist. It's gonna act as an antagonist during pregnancy, and by this way, acting as an antagonist is gonna increase uterine contraction and the separation of the residua, and it is a drug used for abortion. So you have to memorize that mifepristone partial agonist. It is used in abortion during pregnancy. Mechanism of action: blockage of the progesterone receptor to trigger uterine contraction. The B, which is the lowering of LH to thin the endometrial lining. So this is like the progestin, and how it is works as like to inhibit ovulation. So when you give progestin as a contraceptive, it is gonna make a feedback at LH is gonna decrease LH, and the LH is gonna decrease like ovulation, and also it is gonna thin the endometrial lining. It has two effects. It's gonna contribute to the thinning of the endometrial lining. At the same effect, is gonna cause a feedback and decreasing LH, and the LH, by decreasing LH, we gonna decrease ovulation. So this is how it is used as a contraceptive agent. C, which is the stimulation of prostaglandin release, and this is prostaglandin E1 agonist. This is gonna like also used in abortion. Is gonna increase the uterine contraction. So this is a wrong answer, because this patient having ectopic pregnancy, like the baby is not in the uterus. So if we're gonna increase uterine contraction by stimulating prostaglandin or giving mifepristone as a progesterone partial agonist, the baby is like outside. We're gonna like kill these cells, this gestational sac and like yolk sac. We're gonna kill these rapidly dividing cells. This is achieved through inhibition of the DNA synthesis in rapidly dividing trophoblastic cells. So this is like a mechanism of action of methotrexate, which is like a folate antagonist. So it's gonna like dihydrofolate reductase inhibitors, like gonna decrease tetrahydrofolate. The tetrahydrofolate is essential component of the purines and pyrimidines, and by like stopping this reaction is gonna like inhibit the rapidly dividing cells. So the gestational sac, for example, so preferentially is gonna inhibit or interrupt these cells. This is the developing embryo, which is outside of uterus. If we give like something to increase uterine contraction, we're gonna like not kill the developing like cells or the gestational sac, but we can tackle this ectopic pregnancy by killing these cells by giving methotrexate, which is a first-line therapy for ectopic pregnancy, and this is the correct answer. Triggering local inflammation to hinder implantation. This is a mechanism of action of the intrauterine devices by triggering local inflammation and like hindering implantation. But as we have said, the baby is like the growing fetus is outside the bodies. The most common site of ectopic pregnancy is the fallopian tube or whatever site outside of the uterus. So I hope you guys enjoyed our video today and see you in next videos.